Suboxone has helped many different people whose lives were torn to shreds because of opioid addiction. The stigma surrounding medication-assisted treatment can often be the barrier that stands between addiction and recovery. One of the biggest reasons that Suboxone is stigmatized is because of the perpetuated myths that Suboxone just substitutes one drug for another. There is a difference between using a medication to treat a disease and misusing a drug. There's a difference between addiction and dependence. Suboxone has been proven to be a stable, safe drug that can be utilized short or long term to treat opioid use disorders. Some people also believe that you can get high off of Suboxone just like any other opioid. But at the end of the day, intoxication isn't going to occur from Suboxone if a person is already opioid dependent. You can only get intoxicated if you misuse it or combine it with other substances. If a person's head is really in the right place and they take the medication as they should feel stable and never high. Others even say that using Suboxone is just like giving up on yourself. But getting over an opioid addiction is a struggle that involves daily physical and mental work. It's not just some kind of hobby gone wrong. It's a disease within the brain. When using Suboxone, a person's cravings for opioids is being fulfilled without receiving that euphoric high. Because the Suboxone is filling that need, they're able to focus on other aspects of therapy, such as analyzing their psychological health, so they can have the chance at making a full recovery. Often, the factor that keeps those with an opioid addiction from the road of recovery is the effects of withdrawal. They can be debilitating to any individual. The symptoms of opioid withdrawal include severe diarrhea, insomnia, and abdominal cramping. Just to prevent themselves from going through the effects of withdrawal, they'll choose drugs like heroin and opioid painkillers to balance themselves out. Using Suboxone stops that vicious cycle because this medication is an opioid itself. It caters to the cravings of the individual without giving them a high. The key to success is sticking to the doctor's recommendation and administering the medication in a safe setting, accompanied by therapy and other methods of support. Because those with an addiction don't have to worry about going through withdrawals, the rate of relapse lowers. So say you take Suboxone or are thinking about it. How do you handle all of this stigma? It can be rough, but there are a couple of things you can do to manage the stigma and share accurate information about the medication. You can share your progress, because the best weapon against misinformation is proof. As you move further and further through your recovery, share aspects of your journey with the people around you. This is especially important for those who hold an unfair preconceived notion of the use of Suboxone. Educate those around you about your recovery and the things that you have learned through professionals about Suboxone. Another thing you can do is ask for help. Dealing with the stigma of Suboxone can make you feel very alone, especially because there are those in the recovery community who perpetuate these stigmas. Sometimes those who are supposed to be on your side are the ones who will give you a hard time. But there are always going to be those that understand and realize that Suboxone isn't a negative thing. Research, support, and 12-step groups in your area. Go to one that is specifically about opioid addiction. If there aren't any 12-step programs in your area, then you might be able to find an addiction support group online. Facebook has a wide variety of groups that have the same goal. Lastly, to combat the stigma, you can practice self-care. Constantly trying to prove that your method of recovery is beneficial is exhausting. Take time out of your day to do productive activities that will help improve your mental and physical state. For example, you can start a journal or read a book before bed. Put yourself first and make yourself living proof of the medication's benefit. Despite the heavy amount of research backing the use of Suboxone for treating opioid addiction, stigma will probably always be around. Unfortunately, it's just one of those touchy subjects. But if you know that Suboxone is the right choice for you, stay focused on your journey. Spread accurate information to combat the misinformation. Ask for help when you're feeling frustrated, and prioritize self-care. You deserve to live the fulfilling and healthy life that you deserve. And the path that you choose to get to that stable place is valid whether you're using medication or not. If you need help finding a Suboxone clinic or doctor near you, You can use our directory or give us a call at 1-888-501-2143 for more information. We hope that you found this video helpful and informative. On behalf of Find Suboxone Near Me, thank you for watching.